could. Hi, everyone. Thanks so much for joining us today. We really appreciate your patience as we're just working through a few logistics to get us up and running. My name is Melissa Yates. I use she, her pronouns, and I am the Healthy Oregon Workforce Training Opportunity Grant Program Coordinator. As you just got notified, we are recording the meeting today, so we're able to share it out with folks who aren't able to attend. So really appreciate you all being here, and we're gonna go ahead and jump on in. We've got some logistics to cover to kind of set the stage for what we'll be talking about in today's session, and then we'll be working our way through the request for grant proposals. So I will apologize in advance. I have a little bit of a cough, so apologies for a little bit of uh, coughing along the way. So thank you all for your patience. All right. Oh, and also visual description for myself. I have a blurred background. I'm a white woman with chin length brown hair and a black shirt on. And again, my name is Melissa Yates. So thank you all for being here. Could get our next slide, please. So as I mentioned, we're recording the session today. I'll be showing you later in the meeting where you can access it afterwards if you want to re-listen to double check anything that you might have heard. We do have live transcription available. That option is at the bottom of your Zoom window. Sometimes it gets hidden behind the three-dot icon, the more icon. You can choose the caption option there. As you might have noticed, we also have ASL interpretation being offered in today's meeting. That option is available for folks as well. And then we'll have our chat box available for folks to submit questions as we work our way through the session. And I will say some questions we'll be able to answer as we see them. Others I may hold off till we get to a little bit of a breaking point to get back to you. And definitely know that sometimes there are some questions we may have to follow up on after the session. So don't worry if we don't get to the question today, you will get an answer. We'll also be pulling all of the questions out of the chat today and documenting the answers and uploading those for you to view, sort of a quick reference on, or quick-ish reference on Oregon buys, so that all questions, all answers are available for everyone as we work our way through the process for this request for grant proposals. Sometimes seeing those questions can help spark something you hadn't thought of just yet. So we'll have those available as well. All right. So let's see here. Just a few common language, shared language pieces we wanted to highlight. We do our best not to go too deeply into the acronyms as we work through so much detailed information, but we do have a few pretty common ones we use. We just wanted to start off with a few highlights of those. One is RFGP, which is the request for grant proposal, the document that we're here to talk about today for the HOWTO program. HOWTO is another one of those acronyms. It's the Healthy Oregon Workforce Training Opportunity Grant Program. And then two others that you may hear from us today are OHA, which is Oregon Health Authority, as well as OHSU, which is Oregon Health and Science University. Of course, if you hear anything acronym or otherwise from us that isn't familiar to you, please feel free to drop those questions in the chat, and one of us will work on either answering it in the chat, or I'll try and highlight it verbally if there's a question to highlight for the group as well. Another thing that's helpful for us is to know who's here with us. And I know we've got a fairly big group today. So we'll start off if folks could drop your name, pronouns, and organization. Thank you all for being so speedy on this into the chat. It's super helpful for us to know who's here. Another option that Zoom gives you is to right click over your name that's displayed in your Zoom window. If you right click on it, you can select rename if you want to add your organization after your own name as well. It is wonderful to get to see who is here with us today. It really helps us to also get a picture of who has heard about this request for grant proposal so far, and just have a sense of who's joined and who's interested. So thank you for that. And while that continues in with the chat there, we were just going to take a minute to introduce a few of the OHA team or Oregon Health Authority team who are here in support of the How To Round 6 requests for grant proposals. And as I mentioned, I'm Melissa Yates. I use she, her pronouns, and I am the How To Grant Program Coordinator. My colleague Suzanne Chrisman is with the Office of Contracts and Procurement. She is our sole point of contact for this request for grant proposals. She actually isn't able to join us for today's meeting, but you all will see her information in the RFGP and the request for grant proposals as well. Another colleague that I wanted to highlight real quick who wasn't able to join us today is Katrina Dowdy. She is a new addition to the How To team and will be helping to support the work alongside me as well as we move through this process. And then Ritu, if you are able to introduce yourself.
Hello, everyone. Welcome. It's so good to see this crowd here interested in how to. My name is Ritu Tungana, she, her pronouns. I am currently in job rotation as a healthcare workforce team manager. I'm still getting used to it. I have only been here a little less than 2 months. And in that role, I am Melissa Yates, and How To falls within my purview of the program. Yeah, and prior to this, I was with Equity and Inclusion Division in Oregon Health Authority as a data equity policy advisor. Um, and I'm going to pass it back to you, Melissa.
Great, thank you, Ritu. Jessica, did you want to introduce yourself?
Yeah, sorry about that. I was on another screen. My name is Jessica Malmstrom. I just took a big bite of apple. I use the she, her pronouns, and I'm the admin support person for the HERC, as well as the How To and the Healthcare Workforce Committee.
Thanks, Jessica. Perfect timing on my part to hand off right as someone's trying to snack. And apologies, I know that's we're right at the middle of your day. You might be trying to get in a little snack and lunchtime as well. So I appreciate everybody who was able to join us today. I also wanted to highlight one more person supporting the How To team who hasn't been able to join us yet, but that's Neelam Gupta. She's the director for the Clinical Supports Integration and Workforce Unit that How To is a part of here at Oregon Health Authority. All right. So as I mentioned, we're going to spend just a little bit of time talking about the big picture of the how-to program, so a little bit of background and purpose. And then the majority of what we're here to talk about today is really the logistics of the proposal process. So we're going to spend some time going over the requirements, the timeline, and then what you can expect as you dig into putting together the proposal itself, as well as a little bit about the process of submitting it through Oregon BIES. So we know that you all have already been able to dig into the request for grant proposal itself because you all found the link to join us today, which is a part of the request for grant proposals that is on Oregon BIES. But it is also helpful just to have it for quick reference. I'm going to drop that into the chat. If you are interested in following along, we're going to largely, but not exclusively, be following things in the order that they're presented in the request for grant proposals or grant for grant proposal. So that might help you if you're trying to reference back to things or thinking about what you've maybe already had a chance to start working on as your organization thinks about how this request for grant proposals might fit in with the work that you're doing or planning for that proposal itself. So in that link there, there is the opportunity notice is what it's called, that you can link to within that page if you'd like to reference that. Not required at all, but sometimes I know it can be just helpful to see that along the way. All right, so that brings us, like I said, to our first section is going to be talking a bit about the how-to program. We won't spend too much time on it, but it is really helpful to think about the goals and purpose, how this program kind of sits in that context, since it also provides the lens in which we're going to be viewing the proposals. So the how-to program is really committed to creating a healthcare workforce that appropriately meets the needs of Oregonians and is reflective of the communities that are being served. So that's the big picture of the project or of the program goals. It's still a pretty new program. It's been around since 2018. This is just our sixth round of funding. We've had 5 currently awarded, and that has given us a total of 40 how-to grantees to date. If you're interested in learning more about those grantees, we do have that information on our website as well. So it can be a opportunity to kind of get a sense of what's been funded so far within those 40 projects. Sorry, I'll just trying to keep an eye on the chat here as well. So as I mentioned, in terms of the how-to purpose, really focused on trying to address healthcare workforce shortages and trying to expand health professional training to address those shortages, particularly in culturally and linguistically diverse groups that have been economically and socially marginalized, tribal communities, rural communities, and communities experiencing inequities throughout Oregon. So really, again, trying to think about how we support innovative, transformative, community-based training initiatives to address those local workforce shortages and then expand the diversity of the healthcare workforce. I will drop, as I mentioned, that our website has the examples of previous and current grantees. I can drop that link into the chat as well. All right, so just a few details. This is the section starting on page 3 of that request for grant proposals. If you happen to be following along, the proposal requirements and parameters is the title of that section. Next slide. Thank you. So the How-To program core values are outlined in the request for grant proposals. You're also going to see these core values kind of broken down within the scoring rubric that we include on the request for grant proposals page. It's labeled a document 4 and 5. It's combined in one Excel sheet. But again, it's kind of the lens through which we're going to be looking at proposals. So we wanted to reiterate it here. We also just really wanted to draw your attention to seeing how these get reflected throughout that scoring rubric as well. So is aiming to support greater ethnic, racial, cultural, and linguistic diversity and inclusion in Oregon's healthcare workforce, trying to advance trauma-informed care and workforce training programs, address health inequities and social determinants of health, and expand current and/or develop new health professional training in a local area. So one of the most common questions we get is who can apply? And the request for grant proposals is open to all disciplines of the healthcare system. And that can include medical, oral, behavioral, public health as examples. We've had questions about whether health interpreters are included. Yes, absolutely. It's really all areas of the healthcare workforce where there is a need. And part of the proposal will be helping to talk about what that particular need is. So it's very broadly stated, open and excited to receive proposals from all areas of the healthcare workforce. The eligibility is also not dependent on organization type or business designation. So it's another one of those pieces of the request for grant proposal that is very broadly stated. So we've included some examples on the slide. You'll see many of these represented in the How-To grantee list there on our website, but it's not a mutually exclusive. It's not an exclusive list. Just some examples like educational institutions, community-based organizations. It's really whatever the entity is that is seeking to help launch an innovative, a new training initiative. So really focused on these goals again. One thing I would highlight though about who can apply is that organizations can only submit one proposal per round. So organizations can serve as partners on other proposals, but the organization that's submitting the proposal, they can only submit one per round. I would also highlight here too, I don't have it listed on the slide, but it's something that you'll definitely see represented in the list of grantees if you do take a look at that, that this also includes a wide range of focus areas when we talk about healthcare training needs. That isn't just pulling people into the healthcare workforce, right? So it's not just about recruitment. We definitely are also interested in retention, career advancement, whatever the need is that can help to address these shortages. We know they're complex and the solutions are complex. So really trying to reiterate that it's not just that initial step into healthcare. It could be about keeping people in healthcare or helping folks to have leadership and career advancement opportunities, all kinds of different possibilities as examples. So for this round, we do have $9 million to award for the round 6 group. Funding for these projects is for up to 3 years, with up to $1 million total, not per year, but total, to be awarded for a project. So a total of $9 million to award for this round. And projects can request up to $1 million for their projects. And like I said, for up to 3-year timeline. We do have 1 million set aside in that 9 million total that will be reserved for projects who are requesting under $300,000. Just trying to keep the focus on a wide range of budget sizes, a wide range of different project needs, as we consider the wide range of projects that we often receive for these. A few other guidelines and requirements for the funding itself. The budget is able to include many different pieces, but it cannot include capital construction costs. It cannot include maintenance of effort of existing activities. So that maintenance of effort is about, if it's about trying to maintain current funding or maintain current service, that would, as is, that would be considered maintenance of effort. And then another thing that we don't utilize the new funding for is expanding current or previous how-to grant projects as is. Current grantees and previous grantees can apply for a new project, but it needs to be clearly articulated how it's different from the previous round. Apologies for the coughing. Yes, so sorry guys. You'll have to hear the cough drop now. Yeah, so I did see we can include a pretty wide range of things in the proposal itself. We'll get to a little bit more about the narrative for that in just a second. Next slide, please. Thank you. We also do require that proposers do agree to abide by OHA's non-discrimination policy. And we do have that outlined both in the RFGP as well as on the slide here. Thank you. So yeah, we just wanted to outline a few important dates. Some of these are already very familiar to you since you've made it this far in the process. Goodness, sorry about that. The proposal is, or the request for grant proposals is open until December 16th. We do cut the deadline off at 3 p.m. just to allow folks to work with Organize in advance if there's any challenges in wrapping up the submission. Our intention is to make the notice of awards by March 7th. And then the granting, the contract writing and finalizing to get the project started by June 16th. All right, so that kind of brings us to the part of the proposal. And I'm going to give myself 1 second just to get a drink of water real quick. Apologies all. Thank you. Also seeing the requests or those folks who aren't able to stay for the whole time, that's totally okay. As I mentioned, we'll be adding the recording both for this session onto that Organ Bias page I already mentioned, And the previous session is already posted there as well. So same content, less cough from your presenter. But of course, we've got different folks in that session asking different questions. So there's a little bit of different information. But you'll see both the recording and the Q&A document that I mentioned from that October session already on the OregonBuys page. It takes us usually, depending on how much follow-up there is to do, it can take us a few days to get things processed and up on the page. All right. So, like I said, that brings us to kind of the heart of what we're here to talk about, which is what you're putting together to submit as part of the request for grant proposal itself. And there's sort of two chunks of what you'll be submitting. The first is a single PDF. It includes the proposer information form, the project narrative, the budget narrative, and then a couple appendices that we'll talk about. And then there's a second file that you'll be submitting as an Excel file. We do include the template for that. It's listed as document 3 on OregonBuys. It's an Excel file, and we ask that you submit it as an Excel file. And those details are also outlined. We have document 6 within that request for grant proposal page. Document 6 is a checklist, just reiterating what you're seeing, what you're hearing, what you're also seeing in the request for grant proposal opportunity notice. It's just a nice way to double check that nothing got overlooked along the way. All right. Thank you all for your patience and the rough voice today. One other thing I did want to highlight, I mentioned it as we were working our way through today a bit earlier, but I mentioned the scoring rubric, which is document 4 and 5. So again, it's just a set of tools to help continue to reiterate both the priorities and just to double check that as you're answering the pieces of the proposal, that it's the ability to see in advance how we're going to be reviewing those proposals and making sure that those pieces get highlighted throughout your narrative. All right, so yeah, that brings us to the proposer information portion. And the proposer information document itself is going to be is document 1. And document 1 is going to ask you for some information about your organization, whoever is the primary organization, if you have partners on the project. That form also includes some information about how workforce participants are going to continue to guide the work. The different regions or counties that the workforce impact are going to be included or are going to be benefiting from the project. And then we have a question where we ask you to tell us what makes the project innovative. You know your work best, you know the need that you're trying to address best, and we want to hear briefly a summary of what you want to highlight that is innovative about the project itself. The last piece of the proposer information form is the one place where you're going to see a specific maximum for how long it can be. That abstract can be no more than 500 words. So really want to reiterate that is a maximum. It is a requirement to meet that it is under the 500 or no more than 500 words. That abstract is just an overview of the project. It's also something that serves as a broad overview and introduction for reviewers. And then for funded proposals, it also serves as the abstract for some of our grant management documents. So it serves a couple of different purposes throughout the process. Um, all right, so I'm just checking the chat here. Yeah, Brandy, the budget table, that document 3, you can add light items, just needs to be that same overall structure that we use in the template. All right. So for the project narrative, we have a suggested length. Partly what we're trying to reiterate, both within those questions, within the proposer information form, and then within the project narrative, is that we would really like to see clear, relevant, brief, succinct information as much as possible. This is definitely sometimes folks want to, it doesn't need to be a thesis. It doesn't need to be, more is not always better, I guess, is the way of phrasing it, right? Trying to be as clear to the point that helps your goals, your strategies to really shine. So we have a suggested length just to kind of give a ballpark. It's different for those. I see some familiar names who may have applied for previous rounds where we had specific page maximums per section. We did change that for this round. So that it is one of the things that you'll see is a little bit different there. How folks organize it within those different sections is totally up to them, as long as it's clear and getting the point across, provides the information needed. So that project narrative, like I said, this is really the core of what you're planning to do. The problem statement starts things off. It's described on page 8 of the RFGP, but it's really just about being able to briefly describe what the workforce shortage is that the project's addressing and what are the contributing factors. How does that particular workforce need get addressed by the project that you're proposing as part of the How to Round 6 RFGP. It also includes a section on goals, objectives, and outcomes. So kind of what are the big picture, long-term expectations that you expect are going to come from this project? And how is that being broken down into more specific, sort of short and long-term goals? And what's being measured? What are the measurable outcomes from the activities that are part of your project? We also have the program plan. It does include a document 2 timeline. This is a template that we want you to use. You can just tack it in at the end of that number 3 program plan. And this is one of those places where each of the columns, each of the sections that are included in that need to be represented in the document that you include. So it's just trying to tie together sort of the chronology of what's going to happen and how the activities tie back to the different goals and objectives. So that is considered document 2. You'll have the program plan, and then you'll include that timeline, document 2, as part of the program plan. We also ask for an evaluation plan. One thing we highlight in the RFGP that I just want to highlight here as well is just that the evaluation plan is about how the program is going to be assessed throughout the project, not just at the end. Sometimes folks will think, well, how do we know if this project was a success at the end? That's important, but we're also asking what is the evaluation plan throughout the project, so you'll know if things are on track or not, if things need to be adjusted or not. And this can include quantitative and qualitative pieces as well. Then the last 2 pieces, organizational capability, that is both for the submitting organization and any partners that might be involved in the project to support this work. And then we also ask about program sustainability. That is one of the things that you also see outlined in the scoring rubric, that document 4 and 5, where we know these projects are typically for up to 3 years, and these are big tasks, right? Depending on the projects, there's a wide range of implementation timelines. So part of what we want to know is what's happening throughout the project of the grant funding period to set it up to continue once the funding is over, right? So that it's not just getting it up off the ground and then folds, but that there's some mechanism, some strategy, something that you all are looking forward towards being able to help this continue beyond the period. And that it isn't, we know that often evolves over time. So what are the things that you're thinking about, the variety of factors that might be a part of it? That is one of the things that will certainly be a part of our review. And you'll see that, like I said, in the scoring rubric as well. Nikki, I see your question too. We don't necessarily need a particular formatting model. It could be APA if that works for you. But we're not requiring any particular format for the references and such. Yeah. So a couple things that just wanted to highlight that we've seen as maybe folks get tripped up a little bit as they're working through the proposal itself. And I highlighted this back with the project narrative, but part of what we're asking is what is contributing to the workforce shortage, right? So that oftentimes gets really focused on in that problem statement. You're talking about what are the particular factors that are setting the stage for this workforce shortage that you're trying to resolve or improve, right? We know they're complex. Oftentimes we see folks get so focused on the patient need, right? These are such big, the impact of workforce shortages and the impact that has for patient access or the services that patients are able to receive. But don't forget to focus back on how your project is addressing the workforce challenge, right? So what are those contributing factors and how, if the contributing factor is barriers for folks to be able to enter training programs, then how does your project reflect that? If it's barriers to being able to stay in the field, if your project isn't on retention, don't forget to pull those highlights out to make sure that it's not just about the patient experience, but it's really focused. This is, the How-To program is a workforce training opportunity grant program where there's a lot of emphasis as you look at the scoring rubric on how the project addresses the workforce need. So just wanted to reiterate that. And also just, again, keep going back to that scoring rubric to help align the narrative and make sure that it's hitting on the points that you already know are how the reviewers are going to evaluate the proposals. All right. So that brings us to the budget narrative. As I mentioned, we have that template for the budget table itself, but the budget narrative is the opportunity to talk about the justification for those costs and why those are how it's going to match up with the program plan. So I mentioned before the project can request up to $1 million, but we see a pretty wide range of budget sizes. We just are looking in this section here for folks to articulate what it is you need to do the work and why. We often like to highlight here that this could include things like capacity building. So if you need staff to help get the program off the ground, that is one of the wide range of strategies that folks take. with the budget requests. It could also be about addressing barriers for the people that you want to take part in your programs, whether that's transportation costs or stipends. We've seen apprenticeship models and things like that too. So it is really open to the organizations that are proposing to let us know the reason that that's the approach you want to take through that budget narrative. And just reiterating again that what gets outlined in the proposal, right, the activities lines up with the document that includes the budget table, and then that each of those pieces is reflected in the budget narrative. I know this is a ton of information, and you all are hearing it through my scratchy voice, so appreciate all of your patience and just the amount of information we're throwing at you today. Please feel free to keep dropping questions in the chat. It looks like I'm just double checking to see if we've gotten everything covered. All right. Yeah, so then the last section of that PDF, that first PDF document that you'll be putting into your organ by submission are the appendices, and we have two. Appendix A is for letters of commitment from each partner organization if the proposal is multiple groups working together. One of the things we like to remind folks of for this appendix in particular is that these are letters of commitment, not letters of support. So we do not accept letters of support for the proposals. Letters of support tend to be those more broad statements from another organization that's saying, yes, we think they are great. We love this idea. It's sort of just that broad sense of, yes, we support this. We don't accept those letters of support, but what we're looking for is a letter of commitment from any of the organizations that are playing a substantial role in the project. They might have contributing roles, they might be providing resources, or they're receiving funding as part of the budget that you're submitting. So these letters of commitment need to be more specific to really articulate what their role is and what they're bringing to the table, or really kind of thinking of this as the opportunity to make sure everybody's on the same page. And that helps us as we are reviewing the proposals to also see how clearly those roles are already established. So again, letters of commitment rather than those sort of broad letters of support. I see a question about MOUs. So if there is already an established like documented partnership between folks, we'll often see those as part of the grant agreement process. We would still want a specific letter of commitment that's specifically about this project. And the specific funds and roles that are a part of this particular project. If there's already something broadly established, that might not be the level of specifics that we would need for this. The other appendix that we have to wrap up this section are the curriculum vitae, resume, or biographical sketches for key project personnel. So that would wrap up that sort of core, the one PDF that you submit as part of the request for grant proposal. And then the second file that you would be submitting is that separate Excel file that I mentioned that's included as document 3. And that's the budget table template. Since my colleague Suzanne Chrisman isn't here to reiterate, I know one of the things that often comes up from her side as we work through this is to make sure that it doesn't include rounding. Just sometimes ends up throwing off the calculations by a few cents. So we just ask that you submit the Excel format without rounding. I'm just checking the chat here for a second. So I see one question that was about whether or not we would recommend submitting a combined application. If it sounds like it's maybe multiple programs. So would it be better to submit a combined application with the total still being under 1 million, or would it be better to apply for one program in the range of I think the reference there is how I mentioned, and that we're setting aside up to 1 million for those projects that are under 300,000. And for that, I would say it it just depends on what the projects are and whether they would be stronger as an individual project versus combining something to be a larger budget item. We can't say that whether or not it would be more or less competitive in the bigger budget size group or for those projects that are under 300,000. It's really not something that we would have a sense of at this point. So I would say just use your best judgment as you all are looking at what could be included and whether the combination is stronger or if the projects are better separated. In terms of those letters of commitment, it's if working with many different clinical sites, I think it would depend on kind of what the level of involvement for those partners are. On whether or not you need a specific letter of commitment from each one. We define it as a substantial role receiving funds or providing support for the project. A couple more questions. I'm just going to work our way through to the next section and then try and circle back. Depending on the level of specificity, there may be a few that I have to follow up on after the session, but we'll move forward on the presentation, and then I'll circle back here. All right. So then one of the things that we wanted to show a little bit of additional information on is just the Oregon buys process itself. Oregon buys is the e-procurement system that the state of Oregon uses. And you don't need to be registered to view the opportunity notice, as you have already seen with the link that we provided before. But in order to submit a proposal, you do have to be registered in Oregon Buys. We really encourage folks to do that as soon as possible if you aren't already. Being registered in the Oregon Buy system, just making sure if there's any bumps along the way as you and your organization are trying to navigate that, you have plenty of time to work with the Oregon Buy's support if there's any challenges. One of the things that we're doing through the Oregon Buys page this round as well is we're utilizing the question and answer tab. So that's another place where once you've registered, you'll also be able to go in there and submit questions at any time outside of this information session format. And those questions and answers will continue to get documented all the way up until December 2nd, I believe it is. I think I'm getting ahead of myself. I think that's on one of my future slides. So please sign up as early as you can to get that Oregon Buys registration taken care of. And if you go to OregonBuys.gov, we've got the yellow section that's highlighted up there. You can search for the opportunity or the RFGP number, you can also actually just search how to in that, and it'll pull up the how to round 6 page as well, which is what I think it shows on the next slide. Yeah, so that's just showing you, if you just search for the how to rather than the number, you'll get a couple more entries compared to what you see here. And one thing I would also notice, or I would also note on the slide there, the second column over from the right says bid opening date, which is actually the Oregon Buy's terminology for the deadline. So that's, as I mentioned, the December 16th deadline. And then this is just showing you again for folks who have already kind of been in the RFGP and noticed the different resources. This is just showing you what that page looks like. We don't have quite as long as is currently shown there. This was a screenshot as we're a little bit closer to the deadline of December 16th, as I mentioned. But those hyperlinks that you see towards the bottom in green, those are the documents that we've been referencing. Once you register for Oregon Buys and sign in, when you're on this page, you'll also be able to click an option at the bottom that will, it just says follow. And so if you register for Oregon Buys, you sign into Oregon Buys and you go to this page and click that follow, it will then notify you every time there's an update. So like when we post the recording or the Q&A, you'll get notified as changes are made. So it helps to keep you informed along the way. And that's also where the last recording has already been posted as well. Every time we make an addition, it will add a short description of what the change is. That's what you're seeing here. There's an example that's showing you that there have been 3 amendments. Those are just updates. So like when we post the next recording and the Q&A, that'll add an additional amendment there on that page. So it's always a quick way to, or quick-ish, everything is relative here. But it is one way at a glance to take a look at what the changes have been. And so a few pieces of terminology in Oregon Buys. Like I said, it is the system that the state of Oregon is using, and it is being utilized for a wide range of needs. And as a result, the terminology can line up in different ways for some of those different groups. So we just wanted to highlight a few of those. The amendment to a bid is what I had mentioned there, means the same as an addenda to the opportunity notice. Is a change to the request for grant proposal. Bid or bid solicitation is they're using that interchangeably with what we're referring to as the opportunity notice or the RFGP. I already mentioned this, but just really want to reiterate, you'll see it as a countdown at the top of the page is telling you how many days are left before the deadline. And Oregon Buys refers to that as an opening date, which is not particularly intuitive for what is actually when the deadline of accepting proposals. Quote is means the proposer's response or the proposal, and again they're using seller, vendor, where that is really the proposer. So just a little bit of terminology that doesn't always translate across different needs. So we do have a list of some terms. Also, Oregon Buys has a little bit of a glossary as well. But those are the most common questions we often hear from folks. All right. So as I mentioned before, if you do have questions outside of the webinar, we do have the OrganBuy system has a Q&A tab that we're using so that every question and every answer will be viewable to anyone who's signed into the system. So you can continue to get some more information as folks are asking questions. Excuse me. So when you are logged in and then go to the how-to opportunity notice, you'll see a Q&A tab that is available there. And we have added we can accept questions on that page through December 2nd. We'll always be answering questions as they come in. The idea is just to try and have a turnaround time for questions as it nears the deadline. All right. And then, as I mentioned before, questions from the chat, we'll be pulling those chat questions and then providing written answers. The recording for this meeting and the transcript are going to be added as an amendment to that OrganBuys page. So that will continue to be available for your reference as well. And then there's a variety of different supports for OrganBuys itself, since it is a pretty big system. Also, once you get registered, you can continue, you'll get some notifications about other opportunities that are posted that might be relevant for your organization. So we try to provide a few more resources here for those who, if you encounter any bumps along the ways with using the OrganBuys system itself. And there's also technical support help desk that you can utilize for the OrganBuys system itself. All right, I know we've covered a lot. So far, my voice is holding up. I appreciate, again, your all's patience. I'm just taking a look at the chat I know we've got some pretty specific questions, and I just want to take a look to see if there's anything else I haven't covered for our session today. So I see a question about making a proposal for folks to try and advance in their career field. And so we would just say, trying to set up the project to have backup plans as things are being implemented. What are the pieces that the program can control? And how will you gauge your program, thinking about that evaluation piece? What are the milestones for success along the way? If that might be admission to a program that they're trying to advance into, but are there other metrics or other milestones for success as well? So really trying to think about what are the pieces that can be supported through the work that's a part of the proposal itself. Also see a question about electronic health record management. So we don't necessarily need a letter of commitment from something like that sounds like it's more the technical piece, but for the organizations that are a part of the project itself, they might they may be contributing roles, staff support. They may be providing some in-kind resources or receiving resources as part of the project. That kind of partnership would be the kind that we would want to see outlined in those letters of commitment. Just as you can imagine, we all know there's lots of changing leadership between organizations. We also know that the timeline between when a project gets proposed, when it gets the beginning of implementation, and then potentially throughout the up to 3 years of a project. So those letters of commitment are also documenting folks' specific commitments to the project. So that kind of partnership is what we're looking to see documented in those letters of commitment. Yeah, so I also see a question about existing activity versus new programs. And so really, if it's work that's already been, there's work that an organization is already doing, what we would need to see in the proposal is articulating what the additional funds change about the work. Is it so that it would help us to define that it's not that maintenance of effort. It's not just keeping the same services or the same level of funding as is currently already in motion for an organization. So just trying to help it be clear for the reviewers so we understand what's already, what the funds are being utilized to make change for. I also see a question about budget. And so the pieces that are outlined in the proposal itself, we'd want to see how those are supported by the budget that's being requested. If there are additional funds that are needed for the activities that are outlined, we'd want to be able to see what the plan is for those. If those haven't already been established, then making sure that it's clear what can happen with the funds that are a part of the budget that we're seeing. Thanks, all. I'm just keeping an eye on the chat and reading through some of the questions here. So we do allow for a wide range of budget requests that might support staffing. So we sometimes that's stipends, sometimes that's apprenticeship, sometimes it's really what we want to see in that project proposal in the budget and the budget narrative is articulating how the funds are being utilized to address that need. Sometimes that's we've seen folks provide stipends for childcare or for paying for a particular type of training. We know that there's a lot of different challenges. So again, we keep it broadly stated so that really what we're asking to hear from folks is help us understand how the proposal and the budget align to meet the need. I also see a question about the review process. So we'll be using that document 4 and 5 to review the proposals, and we will have both OHA staff members as well as community members recruited that are a part of different aspects of healthcare workforce to take part in the review process. We have a reviewer training and some work through to avoid conflict of interest as part of that process as well. There's not a specific requirement for matching funds as part of the proposal. And then in terms of the work that's already happening versus how the how-to funds could be used to supplement that. Again, since the part of what you'll see reflected in the scoring rubric is about what the how-to funds are changing about what's already in motion. sort of that getting new projects and training opportunities off the ground. Then let's see. Outcomes, I see a question about sort of the employment versus training, I think is the question. We ask for folks to, within the timeline of their projects, you are articulating what you think the evaluation plan is, what you think the outcomes and goals are. And so just making sure that that lines up with the timeline of whatever it is you're proposing. We would love to see folks employed, and if that is an outcome that can be measured within the time frame, that's one possibility. But we're asking for folks to make sure that there's an evaluation plan for in place throughout the project, so it's not just the end point. And then I see a question about reporting requirements. We just have semi-annual progress reports that we ask for those who are awarded, some spending and progress report metrics along the way. All right, so I know there's a lot of questions. I know there's a lot of information that we've shared. Excuse me. And as I mentioned, we'll be pulling the details of the questions out and highlighting those in the document that we'll share on the Oregon Buys website. So you'll be able to see the Q&A in writing as well. And again, thank you all so much for your patience with my somewhat crackly voice. I'm glad it held out there. Really appreciate all of your time and attention today. We'll share the recording on the Oregon Buys website. Again, as I mentioned, you can see the previous recording, same slides, but again, slightly different questions asked every time. But just really appreciate everybody's interest and the time you've taken to hear more about this request for grant proposal. And we look forward to getting to learn more about the work you're all doing as part of those proposals. So thank you again, and really appreciate you all being here. Thanks, everybody.